Well, today marks World Suicide Prevention Day, a time to raise awareness, honor those lost to suicide, and to talk about some of the resources out there. Joining us is Rachel Vitale, Director of Behavioral Health Grants at Hope Network. Thank you for being here with us, Rachel.
Me.
Yeah. Suicide is now the 11th leading cause of death nationwide and the second leading cause for people ages 10 to 34. That's according to the CDC. Rachel, these numbers really highlight the urgency of prevention efforts.
Absolutely. We know that the numbers continue to rise year over year, and the Zero Suicide Initiative is one way that we are helping to hopefully reduce that number. Zero Suicide Initiative is a way to improve suicide care within health systems. It's something we've been doing at Hope Network for almost 5 years now, and a big part of it is the trainings that we're able to offer to staff and to the community, and just the way that we're able to, from a systems point of view, shift what we're doing to better help those that we serve.
Yeah, so there will be free virtual training opportunities. Talk to us more about what will happen during these trainings.
Absolutely. So we have a few different trainings that we offer. Question, Persuade, Refer is a 75-minute gatekeeper training, which allows just the everyday person to learn how to navigate asking someone if they're thinking about harming themselves or killing themselves, how to navigate persuading them to get help, and then also navigating how to refer them to services. And then we also have a little bit longer of a training called Mental Health First Aid. This is in collaboration with the National Council, and this is a full day, 8-hour training that provides just a little bit more detail and depth about how to navigate those suicide or mental health and substance use crisis. So those trainings are available online and virtual so that everyone across the state of Michigan can attend.
Mm-hmm. Rachel, talk about kind of the feedback. What are people saying after they go through these trainings?
Absolutely. People love the trainings. You know, asking that question, are you thinking about killing yourself, is a really awkward question to ask. And being in an environment where you're allowed to practice that in a safe way is incredibly beneficial. The response we've gotten is overwhelmingly positive, both from our staff and from the general community, and we've trained over about 5,000 people in the general public.
Wow. So much needed here in our community.
Absolutely.
All right, Rachel, anything else that you want to share that I missed?
I just want to say that it's okay to not be okay, and help is out there. 988 is one of the best resources that we've come up with as a nation to help navigate a mental health or suicide crisis. Please do not be afraid to call or text or even chat online.
Rachel Vitale with Hope Network, thank you so much for being here with us. We appreciate your time.
Thank you.